I had a severe back problem, and I had surgery previously 20 years ago, and I had an entrapped nerve and a ruptured disc and some old hardware that was moving around. So Dr. Lamacchia was very upfront with me, really appreciated his honesty, and I decided to have the surgery done here. Well, the nerve entrapment was so bad I could hardly walk. So it was through necessity and not just an option. Yeah, I was in a lot of pain prior to surgery, and thankfully after the surgery, that pain is gone. How did the pain limit me in my walking, bending over, lifting? In numerous ways, limited my scope of abilities, really. The surgery process did an MRI to make sure we saw what the problems really were. Dr. Lamacchia was able to pinpoint areas that needed to be addressed. During the surgery, of course, I don't remember any of it, but when I woke up, I had a relief of the pain that was there. Although it was a little bit of a struggle for a day or two, and then it's like somebody turned on a light switch, and I just was really getting better each day, and I was so glad I went to Dr. Lamacchia, really. The pain was pretty much isolated to one area in the L5 area, the lower back, and that's where I had an injury previously, and I was reluctant to have the surgery because of the problems I had previously. And so I kept putting it off, and Dr. Lamacchia says, "You'll know when the time is right. When the pain is great enough, you'll come." The recovery process was wonderful in that we had good care here at the hospital. Dr. Lamacchia was checking on me all the time, had all the assistance and help, the pain medication. For a while there, just really helped bring me through the rougher part of it, and I was glad afterwards, didn't need the pain medicine. I'm doing great. Did I feel comfortable with Dr. Lamacchia? Certainly. He's very upfront, very honest, very professional. His staff was every bit that, and the therapists, the nursing care. I was really privileged and felt that it helped in my recovery. So I had surgery in October, 5.5 hours of surgery, and this is first part of February, and I'm doing physical therapy, but just to strengthen the muscles. I'm clear of pain, which is wonderful. I feel like there's a better movement, and so I'm doing very well in recovery. I am pain-free at this point. In fact, the therapist, when I do exercises, they'll keep asking, "Do you have any pain in your lower back? Do you have this?" I said, "No, the pain is gone, thankfully, and it's a wonderful feeling." Yeah. I had surgery 20 years ago, and I've suffered with the pain for about the last 5 or 6 years, and it kept getting worse. And so to be free from that pain is a wonderful thing. Yeah, there's no doubt that I would recommend Dr. Lamacchia for surgery. In fact, I already have to some people that I know, and one lady is scheduled for surgery now. So yeah, clearly I would recommend Dr. Lamacchia. I feel the activities that I'm doing now that I wasn't able to do before is some lifting. I have to be careful yet, but I certainly don't have the pain associated with the lifting. I'm careful not to lift too much, of course, but I'm looking forward to golfing, which I couldn't do before because of the pain. But the way I feel right now, I could go out and grab the clubs and go for it. So I'm thankful. Yeah.